as part of its 10-to-1 deregulation strategy. So for every one regulation that's introduced, 10 must be removed. In addition to obviously keeping our products safe, one of our huge focuses is driving consumption through health and nutrition initiatives. As part of those 10-to-1 deregulation recommendations for the FDA, we actually urge the agency to recognize produce prescriptions as a supplemental benefit and approved for Medicare. Getting produce prescriptions embedded into the standard of clinical care is one of our many nutrition priorities. And if you've been to any of our programs, yes, I agree. And if you've been to any of our programs over the past 4 years, you know how I feel about the power of produce and floral on health and well-being. It's undeniable the positive impact our products have on people. But honestly, it's incredibly frustrating when behaviors like this around produce consumption are happening.
I notice I feel so much better on the days that I have fruit.
What do you mean the days where you have fruit?
On the days I have fruit. I don't have fruit every day.
You don't have fruit every day?
Are you supposed to?
Yeah, unequivocally.
You're supposed to have fruit? I thought it was like stretching.
Well, you are actually, I think you are supposed to stretch every day.
Who eats fruit every day?
I eat fruit every day.
When was the last time you had a fruit?
About 20 minutes before you came, I had an apple.
Oh my God.
Wait, how often do you eat fruit?
I don't know, like once a week?
Once a week?
Yeah, is that not a lot? I thought that was plenty.
What's happening on the other 6 days?
Mostly like cheese and crackers. I don't know anyone that eats fruit every day.
That can't be true.
Fruit is like mini golf. You do it like once a year with your mom.
I'm just saying, I think if we took a poll, it would show that most of the people we know have a fruit every day.
Call literally anyone in my phone book. Nobody eats fruit every day.
Do it.
Sure.
Do it.
I'll do it right now.
Do it right now.
Hey buddy, quick question. Do you have fruit every day?
I have like a whole piece of fruit, maybe a papaya on a weekend.
How often do you eat fruit?
So let's say I buy a couple apples and grapes. For the next like 2 days or 3 days, I'll eat it multiple times a day. But then I go weeks without having it.
My friend over here thinks that people eat fruit every day. Do you know anyone that eats fruit every day?
No.
I thought everyone was like me, eating fruit every day, and now I'm wondering if I'm eating too much fruit.
Oh, you're definitely eating too much fruit. You're probably drinking too much water too.
Why? How much water do you drink?
I don't know, like 2-3 cups of coffee?
Oh dear. Nutrition and health are at the center of so many conversations right now. It is our moment to be crystal clear on what we believe so we can influence sound, science-based outcomes, especially when those who supply the center of the store are falling all over themselves to put their products in a positive light by complying with rules and mandates. You know the best part? Fresh fruits and vegetables don't have to do a thing. Not a thing. We are the solution. We don't require reformulations. We don't require reductions. We don't require rebrands. Our products are real, whole, and wholesome. And we will not stop until produce is represented in programs focused on diet-related diseases around the world. We believe bold and scalable policies are necessary to drive increase in consumption and advance public health. So rooted in this belief, we fought for Fresh by appointing a chief medical officer to our foundation to guide our worldwide outreach, a promise we made to you last October. We spoke out against questionable assertions made about food production and safety in the first MAHA Commission report. It's worth noting we were among a handful of bold agricultural groups to do so. Others chose to remain silent. We successfully launched and influenced an emphasis on whole, healthy foods versus whole foods in the second MAHA report, which also contained nearly all of our recommendations our policy recommendations on production tools, research, and innovation. And we launched a Fresh Produce for a Healthier America campaign that intentionally put our products front and center with the MAHA Commission. And if you like campaign elements like these, I've got news for you. We're taking the spirit of this effort globally so that policymakers around the world recognize how integral our products, fresh fruits and vegetables, are to global health, and they act on it. This campaign is laser focused on positioning our products as the solution. This is why we provided 8 and then 10 policy recommendations to the MAHA Commission on how fruits and vegetables must be foundational on all public health interventions. This is non-negotiable. We also expanded the Foundation's remit by making commitments to deliver resources to partners abroad and taking part in global forums about nutrition and health in Madrid and Paris. The generosity of our members helped us boost our visibility in policy circles, ranging from the White House Halla Reid event last fall with apples, baby carrots, pumpkins, and mums, to the inauguration's agricultural ball, complete with a flag made of produce and floral, to the White House Easter egg roll, where we gave out fresh produce and 75,000 blooms. IFPA and our foundation envision a world where people live longer, healthier lives because of lifelong fruit and vegetable consumption, from in embryo through to our wiser years. As a result, we will work to drive 3 areas to boost consumption. First, leveraging private-public partnerships. This is how we will have scalable impact and drive systemic change. The key is to demonstrate the value fruits and vegetables have in the broader society. Oh, and also, we can't feed a healthier world unless we have a sustainable, profitable industry. Second, early intervention and child nutrition. Our foundation recently launched a child nutrition education network focused on advancing fruit and vegetable education for children. It will be the hub to map all organizations and programs worldwide and strengthen capabilities through shared tools and learning and attract funding to scale impact. The final focus area is food as medicine for chronic disease prevention and management. In the US, Tufts University found that if all 50 states actually provided medically tailored meals to people who need them, it could save $32 billion annually in net healthcare costs and 3.5 million hospitalizations. $32 billion, 3.5 million hospitalizations. The economic and human impact could not be clearer. Their research also found that over half of respondents would actually try produce prescriptions if offered through healthcare providers. And among those with food and nutrition insecurity threats, increase in produce prescriptions actually rise to almost 70%. You know, diet-related diseases continue to grow. The Lancet report found that obesity will impact more than half of adults and almost 1/3 of our youth by 2050. Only 7% of all countries have adequate health systems to even deal with this crisis. They term this a monumental social failure, and honestly, that's kind of hard to argue against. Helping fuel this disaster is the overconsumption of ultra-processed foods. Research in 14 countries showed a strong association between ultra-processed foods per capita and obesity prevalence. In the US alone, ultra-processed foods comprise 73% of our food supply. More alarmingly, these foods make up 60% of adults' diet and 66% of a child's diet. This is over half their daily calorie intake. Shouldn't half of any daily calorie intake or diet be fresh fruits and vegetables? Yes, exactly, yes. Produce has a powerful role in every diet. GLP-1s have helped many around the world, obviously manage diabetes and weight loss. Nearly 12% of the US population actually have used them. But what's interesting is that GLP-1s have actually provided a lift in our sales. Acosta found that 95% of GLP-1 users have made positive changes to their diets, with 65% increasing their fresh produce purchases. During a foundation webinar recently, Eat Well Global shared that 67% of GLP-1 users actually turn to fruits and vegetables and away from ready-made meals. It's good news for us. Besides pharma solutions, there are also tech solutions to help consumers manage their health, with AI at the center of it all. Remember the AI agents and digital twins that I mentioned earlier? Apple is actually working on an AI agent to replicate a human doctor. By analyzing user data from iPhones and Apple Watches, this agent will serve as almost a virtual coach that offers personalized wellness recommendations, including nutrition. Perhaps the most fascinating intersection of AI and health is the work being done by Twin Health. Each patient gets a digital twin of their metabolism created by 3,000 daily data points that's captured by Bluetooth sensors. Using this data, they track the patient's progress to help them avoid chronic conditions like obesity, prediabetes, and type 2 diabetes. This is then shared with a healthcare professional for personalized nutrition advice. For example, if you tell your digital twin this morning that you're having toast, it may suggest that you pair it with an egg for more protein. If you tell it, I don't care for eggs, it will recommend something equally healthy. But consider what this could mean for produce consumption. As the digital twin analyzes those biomarkers and recommends fruits and vegetables as part of meals. I know, behavior change is hard. And it's a big hurdle to overcome. But the use of AI in this manner could help sway choices and actions when it comes to food. So in everything I've talked about today, from trade, tariffs, supply chain, labor, workplace dynamics, sustainability, food safety, and nutrition, I've shared a look at some of what we've done over the past 12 months in leadership and in service to you, our members. Here's what I hope you take away from today. We're fighting for fresh, and it's working. But for it to continue to keep working, we need you to keep helping. To navigate the headwinds coming our way, to fight on our and your behalf, to ensure we come out on the other side stronger and even more united. Your feedback is essential. So stop me in the hall, at a reception, in the expo floor, follow me into the bathroom. Well, maybe not that. Or use this. Here's my email. Tell me when we've hit the mark or when we've missed. Tell me what you need more of, or maybe less of. Tell me what keeps you up at night. Tell me whatever is on your mind. You know, I began this morning talking about what we believe as an organization. And I'd like to close by talking about what I believe personally. I believe with all my heart that our industry's products, fresh fruits, vegetables, and flowers, create a vibrant future for all. I also believe that in order to create a vibrant future for all, we need to create a vibrant future for you, our members. I believe we must be judged in all of our advocacy efforts on your behalf based on our results, not our actions. And I believe that we achieve those results by working together across markets and across the supply chain. And finally, because of all of this, I believe, Actually, I know. We are just getting started in our fight for fresh. Thank you.
Thank you for joining us for this morning's general session. But don't go anywhere, because the conversation continues right here.